everyone! Welcome back to the channel. The liver is a vital organ in the body, responsible for detoxifying harmful substances, producing bile for digestion, and storing essential nutrients. Despite its resilience, the liver can suffer damage from various factors like excessive alcohol consumption, viral infections, obesity, and certain medications. Often, liver damage manifests in unusual and subtle ways. Here are 12 weird signs of liver damage that you shouldn't ignore. 1. Spider-like blood vessels. Spider angiomas are tiny, spider-like blood vessels visible beneath the skin's surface. These can appear on the face, neck, upper part of the trunk, and arms. They are typically associated with liver disease, especially cirrhosis, and occur due to the liver's inability to metabolize estrogen properly. These angiomas are often bright red and have a central spot with outward radiating blood vessels. While they can appear in healthy individuals, particularly women who are pregnant or using oral contraceptives, a sudden increase in number or size should raise concern. When you notice these small web-like clusters, it's worth checking your liver health, as they may indicate more serious underlying liver issues. 2. Red palms. Red palms, or palmar erythema, cause the palms of the hands to become red and blotchy. The redness is typically more pronounced on the base of the thumb and little finger. This redness is typically not painful, but can be a sign of liver disease, particularly cirrhosis. The underlying cause is often linked to hormonal changes related to impaired liver function, particularly an imbalance in estrogen levels. While it can also be seen in pregnancy and rheumatoid arthritis, when it appears without a clear cause, it's important to consider liver health. This symptom can sometimes be mistaken for a skin condition or allergic reaction, but when it persists, it should prompt a visit to the doctor. 3. Swollen abdomen. A swollen abdomen can be a sign of ascites, the medical term for fluid accumulation in the abdomen, often resulting from severe liver disease such as cirrhosis. Ascites indicate advanced liver disease, occurring due to a combination of increased pressure in the liver's blood vessels and reduced liver function. When the liver is damaged, it fails to produce enough proteins, leading to fluid leakage from blood vessels into the abdominal cavity. This can cause significant discomfort and may be accompanied by rapid weight gain and shortness of breath. The fluid accumulation can also become infected, leading to a life-threatening condition known as spontaneous bacterial peritonitis. Early detection and management are crucial to prevent complications and improve outcomes. 4. Itchy skin. Persistent and unexplained itchy skin, or pruritus, can be a sign of liver damage. Pruritus related to liver disease often results from a condition where bile flow from the liver is reduced or blocked. Bile salts can accumulate under the skin when the liver is not functioning correctly, causing intense itching commonly on the palms and soles. This itching tends to be worse in the evening and can be so severe that it disrupts sleep and affects the quality of life. Often, there are no visible skin changes, making it a perplexing and frustrating symptom. If over-the-counter remedies don't provide relief, it's essential to investigate further with a healthcare provider. 5. Dark urine. Dark urine may indicate liver damage. The liver breaks down bilirubin, a byproduct of red blood cells. When the liver is damaged, it can't process bilirubin properly, leading to its buildup in the blood and excretion through urine. The presence of bilirubin in the urine, known as bilirubinuria, can cause urine to appear dark yellow, brown, or orange even if you're well hydrated. Other symptoms often accompany dark urine, such as jaundice, which together point strongly toward liver dysfunction. 6. Pale stools. The color of your stool can be a telling indicator of liver health. Normally, bile produced by the liver gives stool its brown color. The stool may become pale, clay-colored, or white if the liver is damaged and not producing bile effectively. This change in stool color often indicates a blockage in the bile ducts or other issues with bile production. This symptom should not be ignored, as it can signify serious liver problems that need medical intervention to prevent further complications. Pale stools, also known as acolic stools, occur when bile does not reach the intestines. This can result from gallstones, tumors, or strictures in the bile ducts. Pale stools are often accompanied by other symptoms like jaundice and dark urine, forming a clinical picture that strongly suggests liver or bile duct disease. 7. Easy bruising and bleeding. One of the liver's many functions is producing proteins necessary for blood clotting. When the liver is damaged, its ability to produce these clotting factors diminishes, leading to easy bruising and bleeding. This can result in frequent nosebleeds, bleeding gums, or heavy menstrual periods. If you notice that you're bruising more easily than usual, or that minor cuts take longer to stop bleeding, checking your liver function is a good idea. This symptom is often subtle at first, but can lead to significant bleeding issues if left untreated. 8. Chronic fatigue. Fatigue is a common symptom of many health issues, but chronic, unexplained fatigue can be a sign of liver damage. The liver plays a crucial role in energy metabolism and nutrient storage. When it's not functioning correctly, the body may struggle to produce energy, leading to persistent tiredness and weakness. This fatigue is often described as overwhelming and unrelieved by rest, significantly affecting daily activities and quality of life. If you feel exhausted despite adequate rest, it might be time to consider your liver health. Chronic fatigue can severely impact daily life, overwhelming even simple tasks. 9. Swollen legs and ankles. Swelling in the legs and ankles, known as edema, can occur when the liver is damaged. This happens because the liver's impaired function decreases the production of albumin, a protein that helps keep fluid in the bloodstream. Without sufficient albumin, fluid leaks out of the blood vessels and accumulates in the tissues, particularly in the lower extremities. This fluid buildup can cause significant discomfort and may accompany other symptoms like ascites and shortness of breath. Managing edema involves treating the underlying liver condition and making lifestyle adjustments, such as reducing salt intake and elevating the legs to reduce swelling. Diuretics may also be prescribed to help the body eliminate excess fluid. 10. Nausea and vomiting. While many conditions can cause nausea and vomiting, they are also common symptoms of liver damage. The liver helps filter out toxins from the blood and aid digestion. When it's not working properly, toxins can build up, leading to gastrointestinal distress. These symptoms can significantly impact nutrition and hydration, further complicating liver disease management. Persistent nausea and vomiting, especially if accompanied by other symptoms of liver disease, should be evaluated by a healthcare professional. Chronic nausea can also lead to weight loss and malnutrition if left unchecked. 11. Jaundice. Jaundice is one of the more recognizable signs of liver damage. It causes a yellowing of the skin and the whites of the eyes due to an accumulation of bilirubin in the blood. This occurs when the liver is unable to properly process bilirubin, often due to severe liver conditions like hepatitis or cirrhosis. The yellow discoloration can range from mild to severe and often spreads from the eyes to the skin. Jaundice can result from a variety of liver conditions, including viral hepatitis, alcohol-induced liver disease, and bile duct obstruction. Jaundice can also be associated with dark urine and pale stools, forming a triad of symptoms indicative of liver dysfunction. 12. Confusion and cognitive problems. Hepatic encephalopathy occurs because the liver can no longer filter toxins, such as ammonia, from the blood. These toxins accumulate and affect brain function, leading to symptoms ranging from mild confusion and forgetfulness to severe disorientation and personality changes. In severe cases, hepatic encephalopathy can lead to coma. If you or someone you know is experiencing unexplained cognitive changes, it's crucial to consider liver health as a potential cause. This condition requires immediate medical attention and can be life-threatening if not treated promptly. Treatment focuses on reducing the production and absorption of toxins in the intestines and managing the underlying liver disease. In conclusion, recognizing the subtle and unusual signs of liver damage can lead to early diagnosis and treatment, potentially preventing serious complications. If you notice any of these 12 weird signs, it's important to consult with a healthcare professional to evaluate your liver function and take appropriate action. Early intervention can make a significant difference in managing liver disease and maintaining a healthy, functioning liver. Taking care of your liver is a lifelong commitment. To keep your liver in optimal condition, maintain a healthy diet, exercise regularly, avoid excessive alcohol consumption, and get regular medical checkups. Additionally, being aware of your risk factors and getting vaccinated against hepatitis can further protect your liver from damage. By staying vigilant and proactive, you can ensure your liver remains healthy and functional for years. Thank you for watching. See you in the next video.